Hi, I'm Jeff Terrell with Jeff Terrell Fitness. Today we're going to cover some more of our hip mobility work and get into some static hip flexor stretching. So hip flexor is probably one of the most common areas that seem to tighten up on a lot of individuals that can cause some low back stiffness and pain and discomfort, as well as just leading to poor pelvic positioning when doing things like squats and deadlifts. So one of my favorite stretches to do for the hip flexor to start off with some static stretching is just you take a bench, or ideally if you have like a semi-firm bed mattress or like a table that's sits a little bit higher than like a standard gym bench, that's even better because it'll give you a little more height and range of motion. So the way we're going to set this up is we're going to lie down flat on our back. Okay. From there, we want to get your butt as close to the edge of that counter or bed or mattress or bench, whatever you're using, as possible. You're going to straighten that leg out and just sort of let it hang. Grab the other knee, hug it tight to your chest, and then we're just going to sort of let gravity pull down on that leg. Deep breaths into the nose, out through the mouth. In through the nose. Out through the mouth. And then we're just going to let gravity sort of pull down on that leg. As you can see with my leg, the foot is resting on the ground, so that's not really ideal. If you have something that's really tight, then what you'll see is as they lift up, that other leg will sort of float in the air, as that hip flexor is just sort of pulling on that femur and keeping it up high, whereas we want it to just sort of drop. We want to be able to get about 15 degrees of hip extension there. And so usually we'll hold that, and we'll just try to do that deep breathing for 5 to 10 breaths or 30 to 60 seconds. Switch to the same thing on the other side. If you notice that one side is particularly tight compared to the other side, you can spend more time on that tighter side.